When we see a pink ribbon nowadays, we know it stands for breast cancer awareness. But how aware are you of how the cancer starts and develops? Breast cancer begins in the breast tissue that is made up of glands for milk production called lobules, and the ducts that connect the lobules to the nipple. The remainder of the breast is made up of fatty, connective, and lymphatic tissues. As Dr. Krishnan, specialist at Florida Hospital Waterman Digital Mammography Center explains, breast cancer typically is detected either during a screening examination before symptoms have developed or after symptoms have developed when a woman feels a lump.
The purpose of the mammogram is to get good imaging to detect breast lesions and breast cancer. It's the first step in trying to prevent breast cancer, because the incidence of breast cancer in women, when I first started medical school, was 1 out of 10, and has slowly progressed to 1 out of 9, and some statistics even show 1 out of 8 women are affected by breast cancer. If we find something wrong on a screening mammogram, we contact the patient with a letter, as well as we contact the patient's physician who sent the patient for a mammogram. And within 1 to 2 weeks, they come back for what is called as a diagnostic mammogram. And the diagnostic mammogram can also include an ultrasound, because what we do is, depending on what we find at the time of mammography, whether it's a mass or microcalcifications, we do further specialized views, which include like spot compression and spot magnification views, and we do an extra 90-degree view of that breast. And if it's a mass, we further do an ultrasound, because ultrasound helps us to determine if the mass is solid or cystic. Cystic 99.9% being benign. If it's solid, then we'll have to pursue next to a biopsy. Basically, MRI is used in breast imaging as a problem solver and also for staging of breast cancer. For instance, if we diagnose a breast cancer with a biopsy in one breast, typically we like to do a breast MRI before surgery, because that will stage the disease. And we've actually found in at least 5% of what we've done here so far, we've found another lesion or a lesion in the opposite breast that we would not even have known about. So it's, despite some of the statistics, we work closely with Dr. Mascarenas, and he recently went to a surgery conference. He was saying, oh, they don't order them anymore. And then the next week we had one where the MRI showed a cancer on the other side, whereas the patient had DCAS on the side that we biopsied. So we actually found an invasive cancer on the non-biopsied site. So this obviously plays a role in management of patients, etc.
The battle against breast cancer begins with prevention and early detection. To schedule an appointment and for more information about Florida Hospital Waterman's digital mammography services, follow the Breast Cancer Story link on our homepage at yourhometownhealth.com.